Malo Lele. Good evening, good morning, and good afternoon, and good night, wherever you may be listening from. This is William Puloka. I'm representing the IUHPE Southwestern Pacific. I'm the Vice President at the moment. And we welcome you to this conversation, sharing our stories, looking back and looking forward. And this is part of the series of talk and sessions to celebrate the 70th birthday of IUHPE. We've been here for 70 years. Yes, Yone.
I'm pointing to the 70th logo.
Yes, Yone is pointing to that. We welcome all of you, wherever you may be listening from. This is an international organization, of course, and you are part of us, and we are part of you, and we welcome you. And we welcome also our speakers for today. And we will begin as the theme for this conversation is looking back and looking forward. In order to look forward to move to the next 70 years, we ought to be reminded of the progress, the challenge, the journey that we have shared the last 70 years. So I'm very excited and very happy to invite these speakers to come and join us. And we will begin, there will be 4 speakers, and we will begin with Mihi Radima. Dr. Mihi Radima is one of the leading academic in Maori public health from New Zealand. The Senior Maori Health Research Fellow, a Fulbright Scholar, Harkness Fellow at Harvard, and many, many other things that we can share with her. But one of her passions is Indigenous health and well-being, be it focused on the Maori population, but I think the application we would hear is globally. So we welcome you, Mihi. Thank you very much for your presence, and we're looking forward to your sharing of your story. Mihi Radima.
Tēnā rākau te katoa, mihi ki a koe, mo tēnā mihi mai me te tono, kia hara mai ki te kōrero I te rānei ki o koutou taha. Tōku nei wai Māori te tū noho ki te kaha o koutou whakapau, a me o koutou kaha ki te hiki te oro o te iwi. Kia tātou katoa, tēnā rā tātou katoa. Thank you for that introduction. I'm just going to start sharing my screen. Hopefully we're good to go. So looking back, looking forward, I'm going to share an Indigenous perspective from Aotearoa, New Zealand. So a Maori Indigenous perspective, looking back 70 years to the 1950s and thinking about what was happening here for Maori in Aotearoa. So health promotion or anything much in health in that time was often about delivery to Maori by non-Maori, with little Maori input, guidance, partnership. But this wasn't what Maori wanted. We can see the standard approach in the picture. These are a group of tamariki Maori children being vaccinated, receiving for tuberculosis, which was a major issue at that time. And then on the right, we can see the Maori Women's Welfare League. This was a group that was established in the 1950s and 1951, and they were very much about Maori women advocating and leading Maori health and community development. And since the 1950s through to today, there's been a lot of Maori political activism to move us ahead in health and in other areas. And over time, we've come to understand or come to not so much understand, but articulate what it is that Māori health promotion means to us as Māori. First and foremost, that it's located within a Māori worldview. So where Māori norms, Māori values are at the centre, and where there is leadership and it's centred on Māori people. It's about self-determination, so Māori control over the determinants of health. It's not only about the health of individuals, but of course about collective well-being, seeking to make enduring sustainable. It's the achievement of good health and well-being, but most importantly, the achievement is critical. So then how does that look when we're thinking about contemporary times and change over the past 70 years? Well, obviously, the past 70 years has been a time of immense change and also of adaptation. We can see here in the middle an image of Māori providers delivering COVID vaccinations to Māori tamariki, Māori children. In the top left, we have members of Te Urutā, which is the Māori group of our leaders who have formed to really advocate for the best way to ensure that Māori are vaccinated and that our communities get through COVID in the best possible way. We've also had a growing Māori workforce in health promotion and nursing and medicine and all kinds of areas. And on the right there, you'll see a couple of our emerging Māori leaders in health, Anies Close and Moerangi Tamati, who are working in the Taranaki region, which is where I'm currently based. But it wasn't only about adaptation and change for Māori, but also about adaptation and change for Pākehā working in the health promotion space, working in health, working in housing, working in all kinds of fields. And down the bottom there, you'll see a group of Pākehā who have been on a part of a course that includes how they can develop culturally safe practice as people working in the health sector.
Excuse me, Mihi, I think we kind of lost your slides. Can you share again and your slides?
Okay. Okay, let me see. Crikey. Sorry, just take me a minute to make the screen big and share again. Can you see that?
It's coming through now.
Can you see that?
Yeah, it's coming through.
Oh, very good. Did you see the previous screen to this?
We saw some of it, but maybe you can just repeat it.
Okay, I'll just go back.
The last slide was the one with the tamariki being vaccinated, almost your second slide.
Oh yeah, okay. Well, maybe we'll just, seems to be a bit, oh dear. Okay, that's the one you would have seen?
Yep.
I'll just continue on anyway. So as I said, the last 70 years, it's been a time of adaptation and change for Māori, but also for non-Māori doing health promotion and working with Māori. But despite that, COVID is a good example of the fact that despite a lot of positive changes, we've got a long way to go. So the government's COVID response really implemented a model that took a whole population approach. So it wasn't the approach that was recommended by Maori leadership that wanted a prioritisation of Maori, given what we know about the wide inequities. So in the last month or so, around 50% of daily cases have been Maori. Maori about 5 times more likely than non-Maori to catch COVID, have a higher health and socioeconomic burden, 3 times more likely to die, more than twice as likely to have severe illness and hospitalisation. So there's not really surprises there. But Maori leadership wanted a different approach. And we think, you know, and it makes us think, what would have actually happened if there had been a health promotion approach whereby there was self-determination for Maori in the era of COVID. And there's a really good example of where this happened. And in this slide, you'll see the Te Kaha Medical Centre. The medical centre itself is a district health board funded service. So it's not technically an iwi provider or a tribal provider, a Maori provider, but it's run by Maori, and you'll see the picture there of Rachel Thompson, who is the GP that leads the Te Kaha service. And Te Kaha is a rural Maori community in the Bay of Plenty. So it's run by Maori, its nurses and personnel are all Maori, and they're all from Whanua Apanui, which is the tribe in that area. And so when COVID struck in early 2020, their motivation was, of course, to save Apanui lives, save their people's lives. They knew, as other Maori providers did and Maori leaders, that that national model, a general population approach, was not going to work. And so they took matters into their own hands. They took an approach guided, though, by Maori principles, but also by public health principles. So not necessarily the principles that government were promoting, but public health principles and Maori health principles. Their initiative was led by iwi, in the sense that it was a partnership driven by iwi, but supported by St. John's Ambulance, other Maori providers, and they took a long-term view. So it was a sprint, not a marathon. And they used the networks and structures that had always been in place, so tribal networks and structures. So that meant since 2020, they've had hapu representatives, that's sub-tribe representatives who meet regularly. They currently meet on a weekly basis. They had an iwi or tribal response team, and they did things like you'll see in the picture there, working on border control when we were in lockdown. They did surveys of their people locally, so they knew where everybody was. They've been working on whānau plans. And what it meant was they rolled out early. They didn't follow all of the government guidelines because they just vaccinated everyone from the start. So they had around 80% vaccination at a time when in the rest of the country only about 40% of Māori were vaccinated. They delivered on marae, so Māori community centres, and they were hugely effective. And as you'll see in the image next to Rachel, they were able to access groups like the Mongrel Mob here and deliver vaccinations to people when no one else could get in. So Rachel herself went in to the Mongrel Mob pad and on her own delivered vaccinations to them. So this is something that, you know, mainstream providers would never be able to do. But it's also had a roll-on effect because staff have been able to have a break since they're well ahead of everyone else. They've been able to plan, they're doing scenario planning with iwi and sub-tribe representatives. And as I said, they take a long-term view. So they've established a position for COVID management that's permanent. because they know that there's more to come, and there's also the collateral damage. So what does all this mean when we think about the role of IUHPE? We know that Māori want to take an approach that is focused on self-determination, Māori control. Where does IUHPE fit in, and how has it fitted in the last 70 years? And I would have to say over time, not so well, actually. IUHPE hasn't achieved its potential in working with Māori, but things are changing, and we have seen some really big positives in the last few years. But I think the most important thing to understand, which is entirely consistent with our health promotion approach, is that the role will be a support role, not a leadership role in working with Māori and other Indigenous peoples. But that IUHPE need to think about how they can institutionally embed Indigenous voice at all levels of the organisation. And we've seen some fantastic things happen. Thanks to Sione and his colleagues, who, for example, at the last global conference, partnered with Māori from the very beginning. And so when we saw the conference held here, there was strong Indigenous content, there was strong Māori voice, there were opportunities, there was the space to critique, to develop thinking, distinctly Indigenous thinking, on planetary health, an area critical to Indigenous peoples. So, and also the Waioura Indigenous Peoples Statement for Planetary Health and Sustainable Development, there was the space for Indigenous peoples to develop that. So, and also there was the supplement of global health promotion that came out at the same time. So those are really exciting things. And, you know, as Māori, I think, not that I speak on behalf of Māori, but certainly among my colleagues, we are really excited and looking forward to the next conference, but also, you know, when the conference was held in New Zealand, we were really concerned about would these huge gains be able to be maintained and achieved and, you know, seen in the conference in May next year. The other thing that Indigenous peoples are seeking and is in the Waioura statement is that there's privileging of Indigenous paradigms. Now, the value of that is obvious when we think about planetary health, but also in areas like in relation to COVID and working with communities, because it's so important that we take an approach where we prioritise the collective over the individual. So I'll finish there and say thank you to our chair for letting me know we could go a little bit over today, which I've taken full advantage of, and I'll just pass it back to you. Kia ora. Now, just figuring out how to unshare. Please, others that have control, feel free to unshare my presentation. Oh, there it is. Thank you.
You are still muted.
You're still muted,
Mr. Chairman.
Welcome everybody, and thank you very much for your korero, Mihi. And I think Mihi, of course, really emphasized the importance of the Indigenous health and well-being, and the fact that IUHPE and everything else we have been doing, it's okay, but there's a long way to go yet. And Indigenous people are actually the group of people all over the world who are living in the last mile. And those are often the ones that got left behind. And hopefully, as we moving forward to the next 70 years, something better, especially with using the health promotion to empower and enable them to be in charge of their own destiny. Thank you once again, Mihi, and you are listening to the Southwestern Pacific webinar talking about the celebration of the 70th birthday of IUHPE, of which we're gonna go next to Rosemary. Rosemary, is Dr. Rosemary Urban is being quoted to be the longest serving member of IUHPE. And she has served in so many different regions. Started off in Germany for 53 years now. She has been a member. And you know, IUHPE is only 70 years old. So way back then in Germany, she was in charge of the international work at the Federal Center for Health Education, and then become a member, which was the WHO collaborating center. And then he became the regional director for Europe and joined the WHO and actually worked in Geneva for the WHO, become the IUHPE regional director for Southwestern Pacific region, and so forth and so on. But we're so happy and blessed that we have Rosemary here in person to share with us, you know, something that you were doing, we were not born yet, and looking back and looking forward. So we welcome you, Rosemary, and thank you very much. I'll hand it over to you.
Thank you very much, William. Excuse me, I should have done this before. And hello to everybody and to all my colleagues. Yeah, I'm happy to be able to join in again and to share with you some of the issues, if we look back of the development of IUHPE. The Southwest Pacific region is a relatively young structure within the International Union compared to Europe and South America and North America. They started in the late 1950s and in the early 1960s. But that there was not a regional structure does not mean that in this region nothing happened. In the contrary, in the 11th International Conference on Health Education was held in Hobart, in Tasmania, in 1982. It was not organized through a structure, but through very active, within the union, active members, but as well with the support of the Australian, at that time, Australian Society of Health Education. I suppose that was the group that worked before the Australian Health Promotion Association was created. So the theme of that conference in Hobart in 1982 was towards health for all by the year 2000. You will all remember that very dynamic time that after 78 in Alma-Ata, WHO put out the program of health for all, but in the year 2000, or by the year 2000, in 1980. And then, especially in Europe, they started to fill their program with meaning. So in August 1982, there was a first concept paper on lifestyles and living conditions and their impact on health, which actually was presented at the IUHPE conference in Tasmania. So I want to say that this connection between WHO and IUHPE has been there as well here in the region, even we didn't have a formal structure. And if you, I don't know who of you remembers it, but that was then followed in 1988, following the first health promotion conference in Ottawa in 1978. in 1986, where the famous Ottawa Charter was created. Here in Australia, there was the second WHO Global Conference on Health Promotion, and they agreed on, that was in Adelaide in 1988, on, in the spirit of Alma Ata, on recommendations on public healthy policies. So that was a big step forward. And as you all know, meanwhile, there are many more global conferences on health promotion. And this was done without a structure, a formal structure of IOHPE. And of course, in many individuals in our region here connected directly with Europe. So they didn't think it was necessary to have a local structure for the union. However, there was the IUHPE conference in Japan in 1996. And Don Natlim, who at that time was at the University of Sydney, became our regional vice president. And he then started to create a structure with a European, an office, and appointed Marilyn Rice as the first regional director for the Southwest Pacific of IUHPE. And here I come in when I retired from WHO in 1998. I became an adjunct associate professor in Griffith University in Australia, and I was entrusted with the role of regional director. And I think from there onwards, we really made a lot of efforts to create a structure for the entire region, to include the Pacific Islands, to gain members from many different countries. We had Tongans, we had Fijians. So I think that was a very important step to involve all members, or even recruit members in our region. I think the highlight of my time as regional director was the conference, IUHPE conference in 2004 in Melbourne, which was a very, I think, important event with a lot of the themes important to health promotion, healthy environments, globalization, etc. And during the General Assembly in Melbourne, it was for the first time that not only one, but 3 different resolutions were agreed upon on Indigenous health. And I think that was for the Union, again, a milestone to emphasize the importance of working with Indigenous people all over the world. And there were some specific recommendations, for example, for creating a network of Indigenous health promotion professionals. I handed over my role as regional director after the conference to Jan Ritchie, who continued to work and build up the region. And as I was still in the regional committee and always bothered everybody about putting into action these Indigenous resolutions, I was in the end requested to work on that. And so I built up a regional working group on Indigenous health promotion. And I was chair of this working group from 2006 to 2011 until New Zealand took over with Heather as the chair of this regional working group. And one of the recommendations was as well further followed up. The creation of an international network on health promotion. But we had here in Australia several workshops, success stories in two actually, success stories in Indigenous health promotion, which were as well published. In 2010, during the Geneva conference, where we had a huge and a very successful sessions on Indigenous health promotion, I became the one in charge of the network, which was created actually in 2007 in Vancouver. And Mihi will remember that. Mihi, you were there at this event when it all started. And so then in Geneva, we had a very successful meeting. We even, all the Indigenous people met with WHO staff in WHO. So I think it was a very successful start and led basically then to the conference in Pattaya, where we again had as an international network with many Indigenous people who had not joined before, Indigenous people even from China and India and Taiwan. And the resolution there out of this meeting were then brought forward from Pattaya in 2010. Someone else took over from New Zealand, took over the network. And so basically my report stops here about the development. I have seen the results and the input, of course, during your conference in New Zealand, the next after Pattaya, where there were a lot of Indigenous input. And all this is still very close to my heart. And I do hope that the next conference in Ottawa will again see a very strong Indigenous input and a revived and very active international network of Indigenous health promotion professionals. Thank you, Vivian. I think this is where I will stop, but if you have questions.
Thank you very much, Rosemary. As I said, if you're just joining us, welcome. This is the Western Pacific, Southwestern Pacific IUHPE webinar. And we have just been listening to Dr. Rosemary Urban, who is linking us to way back to the beginning of this organization. Fascinating to hear that you didn't really have such structure that we have now. You were organically growing the structure. And obviously, as you state yourself, it was very much still Euro-eccentric as many things still happening. But now you are looking further afield and especially paying attention to the many Indigenous people with Indigenous knowledge and wisdom and all that. And I think there's a fascinating phase of the development over the last 70 years. And as you just picked up quite naturally from where Mihi left and continue the conversation, Indigenous people. We will go now to, so thank you very much again for that, Rosemary. We will go to Vivian, Professor Vivian Lin. And then, of course, last but not the least will be Professor Evelyn. So hang in there. Welcome, and we welcome you back. We're just really trotting around, even though there's no traveling, but we actually do travel to different places. You know, we've just been to Australia, and now we go to Hong Kong, where Vivian is there. Professor Vivian, who is currently the Executive Associate Dean and a Professor of Public Health at the University in Hong Kong, Lee Ka-shing. but she's a former director of the health system with WHO, like Rosemary. They work for the WHO, but was working in the Western Pacific region. Also, like Rosemary, very much alike. He was also working in Australia, investing in La Trobe in Australia, I understand. And a former ex-global board vice president, scientific affairs with IUHPE. So let's welcome Professor Vivian Lin to continue our conversation about looking back as we are moving forward to the next 70 years of IUHPE Southwestern Pacific. Professor Vivian Lin.
Thank you so much, Viliami, and thank you, Rosemary, for that wonderful, encapsulation of the history and the excitement of the times. And I certainly do remember when I first arrived in Australia and took up a job in the New South Wales Health Department, the excitement that was buzzing about the 1982 conference and how that really energized what was really a fairly young group of people working as health educators and in health promotion to really move things forward. So what I'll do is really give a more of a regional and global perspective and try to reflect on the contribution of the region to these developments and what the region in a sense is noted for. And to some extent, to be asked to talk about the present, it's a little bit hard to say what's the present, because the present is a reflection of yesterday. And the present is really also the foundation for tomorrow. So I think I'm kind of in this transition between the two. And if I think about, the region as it's grown, I certainly think that those early 80s was really, really important in terms of the Australian government investment. And I think that's really helped both bring lessons regionally as well as globally. And that was the establishment of a Better Health Commission, the National Better Health Program, at also the same time as the WHO Adelaide conference that Rosemary mentioned. So these were all, I think, really important engines. And then there was the investment in public health education and research program, or FERP. And that really grew a lot of the health promotion programs. And particularly, they were not in the medical schools, in the other universities. But at the same time, I think the other legacy of Rosemary is actually the WHO work as the first regional advisor, the whole development of that settings approach. And then that was so important, both across Asia and the Pacific. And I think this is something that really the region was very much ahead of so much other parts of the world. Whereas there was a very strong focus, understandably, on a lot of NCD risk factors elsewhere, the work on the settings really pushed forward in the region. And of course, then following Rosemary, Susie Mercado initiated the Health Promotion Leadership Program, PROLI, that really then put more emphasis on health promotion infrastructure and financing. Because without the money, without the infrastructure, without the capacity in a system, you cannot actually really achieve sustainable gain. So I think they were some of the important foundations. So if I look today at, the kind of achievements that are really well noted, as I said, settings has become kind of a core model, but we also see very strong models in policy advocacy, and tobacco control is probably the one that the region is really, really well known for. But the community engagement that comes from the HIV work is another thing that's really strong. And of course, quite a lot of very, very good social marketing work. So it really was this kind of comprehensive approach in the way that health promotion is meant to be done. And beyond sort of these methods or programmatic models, we could see the work coming from both government as well as like the Australian Health Promotion Association around infrastructure, capacity, defining competencies, and the the dialogues that was starting around what is evidence and the right kind of evidence. The intersectoral governance was, I think, another conversation that the region was very important in pushing forward. And that includes the health in all policies, the health impact assessment, and of course, the focus on Indigenous health. I think these were all some of the frontiers that were very much pushed by the regions. And the adoption of Healthy Islands vision in the Pacific, in a sense, really was the penultimate expression of health promotion values and approaches in the way that we actually look at whole of government, whole of society, whole of the health system. And so I think through this journey, it took WIPRO, the Western Pacific Regional Office, a long time to actually get a regional strategy on health promotion. Somehow the system was always more comfortable with, specific risk factors, and that reflected still where governments were before. But in the last few years, we've seen the more system-oriented, the more cross-cutting issues such as urban health and health promotion and climate change come much more into the mainstream. But the IUHPE engagement in all these processes internationally, I think it's hampered by the challenge of volunteerism. It's about people who have time to give, as well as people who are able to get the institutional support. So where individuals were able to get the institutional support, then they can help IUHPE as an organization have stronger participation. So where does this take us to? I think now health promotion is absolutely looked at as core to public health and absolutely integrated in really all the health programs and strategies we see, from communicable diseases to non-communicable diseases. It's really embedded in schools of public health. We have more health promotion foundations in the Asia Pacific region than anywhere else in the world. And that really speaks to the financial investment and the infrastructures needed. And continue to be really amazed by the young, enthusiastic graduates. So unlike some other fields, it's not just a group of us aging workforce, but there's really a lively next generation, which speaks really, really well. But we also do have some dilemmas. And this comes from, in a sense, what we say in health promotion, that it's everybody's business. And when it's everybody's business, it can be nobody's business. So despite the fact that the health promotion strategies are so integral to the achievements in so many areas of health, sometimes it's just not recognized by others as actually being health promotion. So credit is not being given, and the work of health promoters are not, in my view, given as much credibility as is actually deserved. And so there are still elements in the health system who do not appreciate the contribution and either think of it as posters and pamphlets still, as in the 1950s, or they think, oh, this is just all theoretical, and have you saved any lives today? So this remains, I think, some of the challenge. And I think in many ways for health promotion, the equity and social determinants have been at the core of health promotion for such a long time. But how we really move forward, health promotion has promoted a partnership model, a very inclusive model. But how good is it at the real political positioning and the really sharp end of politics that it takes to actually address these issues? So I see those as some of the dilemmas that we face coming out of this, I think, success. So now perhaps just to say a couple things that may lead to the future. COVID, we cannot get away from COVID. And COVID has really revealed all the current issues that have been core to health promotion for a long time. Social inequities, health inequities, vulnerable populations, marginalized communities. And it took a long time before health systems in various countries realized that the outreach, the community engagement, the partnership with social institutions is actually so vital. And the way we have to actually transform health services and the way health services work. And that health literacy is absolutely core. It's not a top-down exercise of disease control, but it really is about engaging all of society. COVID reveals all these problems, but a lot of the issues are not unique to COVID. They've just been brought to the fore. So we have these huge, huge problems because COVID, in a sense, points to the triple burden of health problems, the NCDs, the emerging infectious diseases, the ecosystem challenges that we face, the drivers of urbanization and globalization, and with that, migration, social and economic inequities, cultural hegemony through the media and trade. And then we see in so many countries, short-term populist politics and the social and political polarization. But at the same time, the response to COVID reveals some also interesting possibilities, a more holistic understanding of the relationship between mental health and physical health, and particularly, I think, the importance of mental health and well-being. The adoption of digital means at the individual and group level, the decreased carbon footprint and what a green recovery might look like. And the gender and socioeconomic inequity issues that really require attention in terms of resource redistribution. So the question I ask for the future is, where is health promotion in this? Is it the same agenda as we have had leading to today, or do we reshape, reframe, re-engage, re-partner? And how do we as a region tap into various regional networks and global networks and go beyond sort of our national association framework and really think about our global connections to move forward? So perhaps those are the questions I pose for Evelyn, who will be the future commentator. Thank you very much.
Bravo. Very good.
Muted.
Viliami, unmute.
Thank you very much, Vivian. It's a great presentation, and you have gone through so much. And once again, we welcome you if you have just joined us. This is IUHPE Southwestern Pacific webinar celebrating the 70th birthday of IUHPE. In order to to move forward, we're looking back to and looking forward. And now we come to our last speaker for today. And of course, you have the opportunity to ask any questions. You can email us and contact us. But before I give it to Professor Evelyn Liu, who have so many things to talk about, but I think there are two things that came out of the big information about. It's about the health equity and healthy urban environments. And I think it just linked quite nicely with what Vivian was just talking about, the question of whether we are to reshape, reframe or re-engage and maybe reimagine what health promotion is. So let me give it to Professor Evelyn is currently editor-in-chief of the Health Promotion International Journal, and so many other things that she's involved in. But I think I would not go through that, and we have shared with you the information about each of the prominent speakers. But I would like to hand it over to you now, and I like what was said before by Rosemary, and also linking with Vivian. They were talking about wanting to discuss what's happening today, and it reminds me of a saying that today is the tomorrow we dreamt about yesterday. And I think Evelyn will say something about that. Thank you and welcome everyone. And I'll hand it over to you, Evelyn.
Thanks, Viliami, and thanks both Rosemary, Mihi, Vivian for setting the stage for the future. Obviously, I'm no Nostradamus. I don't know what the future will be, but I'm starting my screen share. First of all, before I do anything, here we go. I want to acknowledge that I speak to you from Gadigal land, which other people know as the Inner West in Sydney, and my offices are on Tharawal and Gandangara land in southwestern Sydney, which is a meeting place for Indigenous mobs down there. And I acknowledge that this territory is unceded and that elders have always cared for this land and will continue to do so forever. So I was challenged in thinking about the future. And in a way, as you will realize, this is really a back to the future. All the ambitions that we've had in the past are coming back, and we need to refresh. We need to re-establish ourselves, as Vivian pointed out, and re-engage with new realities out there. And Viliami alluded to the fact that I'm active in urban health or urban health promotion. I lead something that you see on this screen, Maridulu Budiara Gumal, which is an indigenous expression for healthy urban environments. And I'm also the head of the Center for Health Equity Training, Research and Evaluation. And clearly we do the future now. When I had to think about the future of health promotion, there's two things that we need to reflect on. There's the future of health promotion, and I want to reflect in this presentation on the slightly more immediate future, and the future of IUHPE as the vehicle for health promotion globally and here in the region. Talking about the future of health promotion, very soon, in 2 weeks, we will have the 10th Global Conference on Health Promotion, an online enterprise, and the registration is free. The website is here, so sign up. IUHPE and our different working groups and efforts are being very firmly represented there. In addition to what Sione said earlier about indigenous health and Waiora, planetary health, we are organizing with a bunch of friends and colleagues from around the world a political health promotion forum. And you may want to join us on the 13th of December to engage in the discussion there. The other conference, and we at IOHPE see this WHO conference as a prelude to our big next conference in May next year, is the 24th IOHPE World Conference. And as you had seen on the opening slide, the theme of that conference is promoting policies for health, well-being and equity. And rather than having that as rhetoric, nice words that can easily do some magic in your brain, the conference committees decided that we needed to put some meat on those terms. If we really want to promote policies for well-being, health and equity, what does that mean? We need to acknowledge things like power. We need to face up to inequity. We need to address the challenges that populations around the world have been facing over the last 2 years in COVID. So what we did maybe for the first time in the history of IOHPE conferences, but I'm happy to listen to the history that's present here. We wrote a political platform for our conference. We said, if we want to do this, how do we do it? And we wrote a commentary in Global Health Promotion, dismantling the status quo, an IOHPE 2022 prelude. So we set out what the agenda is. What do we need to do? What are the challenges really for health promotion? And in thinking this through and discussing this with our colleagues around the world in all sorts of different global working groups, the regional offices, we realized that this is all about breaking stuff, so hence dismantling the status quo. This is the conference program, and we will look at breaking news. So what's new? What are we facing? What haven't we taken into account? We need to seize current opportunities and challenges. The other thing is we need to break free. We need to break free from traditional views of how the world is run. Maybe we don't want to be a global organization. Maybe we want to be an amalgamate of many little local organizations and become a truly global organization. But this is also addressing things like colonization and decolonization, not just in a geospatial, territorial sense, but in a knowledge sense. Much of our knowledge is Western, driven by Western paradigms, by Cartesian thinking. And as Mihi suggested, we need to embrace more inclusive, community-based ways of appreciating and implementing knowledge. So we need to move beyond inequity and division. But having acknowledged that, we also need to break through. We need to actually take action to innovate and do things better. We need to be radical about that, and that's really our conference agenda. We really want to think about the opportunities to innovate for today and tomorrow. And we really want to be quite challenging, and we have a lineup of plenary speakers, sub-plenary sessions, mostly organized by IOHPE bodies, but also a massive 1,200 presentations during our conference that will address all of these things. For those of you who have not submitted anything and now listening to this feel sorry about not having submitted, there will be a short window of late breaking submissions in January. So monitor the website that we have, IOHPE2022.com. And this is also facilitating early bird registrations, which we have extended to the 24th of January. So register. It's a hybrid conference. You can come to Montreal, hopefully, but you can also attend online. Now, the future. What will the future bring? Well, I've obviously thought about this. There's the usual suspects. There's the stuff that we heard about from Rosemary, Mihi, Vivian, and they include things like big data and technology. In my own space, urban health, there is a bit of confusion between smart cities and healthy cities. And the idea is in smart cities that the more data you collect with technology that hangs around and pings your devices and gets metadata out of your pocket, that the more data we have, the better we can shape our environment. Now, the thing there is that data is only as good as it's collected, and automated collection of big data, I think, doesn't really provide a lot of insight. And insight really is what you need in big data. So we need to manage this. And I will come back to this as a real future challenge that we will be facing at our conference. The other thing, and that was alluded to by Vivian, as populist policies or populist leadership. And we do see a lot of alternative facts, echo chambers, and a lack of true literacy, health literacy, but also other types of literacy. Our social media are not playing a very pleasant role in this. Anti-vaxxer movements, ideas about the reality of running politics are all issues that we need to confront. right now, but also the ability of us to confront these issues shapes the future opportunities for the international health promotion community. And this really is something that we need to address. Clearly, and that's the consistent message across the last hour or so, we need to face up to the rhetoric of inclusion and diversity and equity, obviously. These are not just words. We need to do this. And how do we do this is a constant challenge, and we need to do that on a daily basis. And you have to start in your own lives, in your own family, community, in your own work, to work toward this and advocate for inclusion and diversity more militantly, I believe, than we currently do in nice words. That includes for us the different rhetoric around different communities of color, culture, etc. What I'm amazed with is that in different parts of the world, there are different acronyms to describe different people of color. So CULT is the thing here in Australia, culturally and linguistically diverse people. In other parts of the world, it's BIPOC, especially the Americas. And in Britain and in the British Commonwealth, there are BAMI, not Nasi or Bami Goreng, but Bame communities. And they have been driven by social movements like Me Too and Black Lives Matter. Now, if we want to re-engage, reinvent and reorganize ourselves, there's much to be learned from the social movements around these two issues that have been emerging over the last couple of years, and we really need to join forces with these, and that's what we argue in that paper. Lastly, in the usual suspects is indeed the legacy of the Rotorua Conference, Waiora, planetary health and climate change, and in spite of some progress recently in Glasgow, we still have a lot to engage with and change. And again, we made a comment from the university that I'm based in, the University of New South Wales, how abysmal Australia is leading the region, and by default, therefore, the world. We are the worst performers on any scale when it comes to climate change response, preparedness, and adaptability. So again, we can't trust our politicians. We need to do it ourselves and thereby change the policies and politics of the world. And I think Waiora and the legacy of the Rotorua Conference actually gives us very concrete handles how to do that. And for the conference that I am, and I'm chairing the Global Scientific Committee for our next conference, we really connect to Rotorua and we carry that legacy throughout the program, and we hope to transmit it into the next conference. There's also, apart from those usual suspects, a number of newish things that we need to face head on. There's the morality and ethics of social media. We health promoters, we come from a behavior change background. One of the things that we're good at is health behavior change. What we're not so good at is to address the cynical dimension of social media and how they shape our world. And there are moral dimensions, and one of the keynote speakers in our conference will be talking to this. The other thing, and this is climate change, urban health, equity, is more broadly infrastructure for health. And you can look at infrastructure at a number of different levels: red infrastructure, built environment; green ecosystems; blue water; gray services, and there are many other infrastructures. And we shaped an opportunity here to actually address infrastructure and health, or infrastructure for health. Viliami kindly noted that I'm the editor-in-chief of Health Promotion International. I will stop being that, but I will start a new big Oxford University Press journal next year called Infrastructure and Health, Big Decisions for Health. And we will look at these big things, and not just big roads, big rail, but also big ecosystems, big inclusion. And the question ultimately is, in all of this, is there still a role for health promotion? In reinventing ourselves as urban planning, infrastructure and health, morality and ethics, what role does the union have to play? And I don't know. What I know is that we do this together, and we are inviting everybody to join us at least next year in Montreal, but on a joint journey toward the future. Thank you.
I remember to unmute myself first. Yes, I think, Sione, are you want to make a? Did you raise your hand?
No, I was congratulating.
Oh, yeah,
the
okay.
speaker,
Thank you very much.
But if there's a chance, when
Yeah.
there's a chance, we can contribute.
I want to thank you very much, Evelyn, for such a enlightening and challenging discussion that you have brought to the fore. I particularly like the way you looking into the future. You know, we all sort of shy away from the future with the excuse that we don't know what's the future. But as you and other speakers have said, well, you know, the future is here, it's now. Our future is here, and we are actually living in the future. But thank you very much for all those very, very important, and for all the speakers, you constantly raise the question, so where is health promotion going to be located? How relevant is health promotion continue to go forward? I see Vivian, and I think I will just give the speakers first an opportunity to say something. Vivian, and then Evelyn, and then Sione, please.
My hand was a clap. I think it's great. It's been such a lovely conversation, both to think about the past, as well as to think about where does it take us to. I think there are some big existential questions. And I think one of the challenges is for IUHPE, what is that balance between the health promotion profession versus the project of promoting health?
Great. Yes. Evelyn, you have any last word to share with us before I ask Rosemary?
Well, there's one question or challenge that keeps nagging at me, and that is, you know, IUHPE 70 years, and for 70 years we've really set the agenda for health promotion. The Ottawa Charter only came along halfway through our journey. So, you know, we don't need big statements from the World Health Organization to shape our existence. And at the same time, we currently see how the union is somehow losing the mobilizing power of its membership. There's not hundreds or thousands of members. There are relatively few people who join the global network of health promoters. And that is probably because everybody thinks, you know, and I mentioned social media and the internet and all that. You can get anything you need for free off the internet. And the real question is, what is the added value of a global network of health promotion or health promoters? And I think we have demonstrated that by having this conversation and by reaching out to each other, we establish that connection more than anything else. So we need to confront that question and really think about the added value of the conversation that we're having.
Thank you. Rosemary, if I may ask, any last word from you?
Well, I just would like to support what Evelyn just said. I still think after 70 years, and I knew the founders of IUHPE and the first activists, I think this organization still can or has to play a big role. And I would hope, I really do hope, that we get new members with new approaches, and Ottawa seems to be a way forward as well to attract new members and new people and a diverse group of scientists. So I would hope the union will continue to exist, not just out of sentiment, but I do think people can make huge contributions. Thank you, Vivian.
Before I go to Sione, Mihi, is there any last word from you?
I might just pick up actually on a point that Vivian made, which was around the challenges that IUHPE faces because of the reliance on volunteerism, and that in order to really be able to fully participate and contribute to the work of IUHPE, one has to have the capacity, and that often means has to have institutional support for the time that is committed to the work of IUHPE. And in our context, I think that's a real challenge for Māori health promoters, because obviously when you're part of and working with inside and outside of your formal roles, communities that are facing huge burdens and challenges, it can be difficult to see the value of a global organisation when you actually need to meet the very real, day-to-day difficulties that communities are working through. That's a difficulty that I've seen, and the only way that I can see, around that is where, there are specific roles, funded roles for Indigenous peoples, because, many of my colleagues I always see, there's, the day job, but if they're working in Indigenous health, actually that's really a 24/7 kind of a job. That was all.
Thank you very much. And I think we still have about 5 minutes to go, and I'll give the opportunity to Sione.
Thank you, Beriami. Wonderful reflections and contributions of the, our speakers, and again a big thank you, along with the gratitude expressed already by others. A few things that I can say. One is I'd like to make a distinction between the body of knowledge of health promotion, and on the other hand, the vehicle that carries that. In this case, we are looking at a common global vehicle of the International Union, IUHPE. Now, the course itself, it has great efficacy, but the potentialities are still latent, yet to be fully exploited. On our part of our team, we observe, we discern the mega trends for some decades. And then we observe that the well-being of our one common home, planet F, is going to be the biggest issue in the world. And then we understudied the vehicle, IUHPE, for more than 10 years. I first went to 2007 Vancouver, met Mihi, I met Rosemary. She might not recall that first meeting at the side symposium that was held by Mihi and Megan Tangs and others. I also met a few others there. I had, of course, Michael Marmot and Jeff Redding, Indigenous Canadian, and of course, Ilona Gigbush, and all of that. And then I went again to Geneva and get to know the organization really well. Then I invited my two other colleagues in our small team, Trevor Simpson, some of you know, and Karen Hicks, to go and look for themselves what it's like at a global level. If they think it's greener, they know it's as dry and gray as us down in the national level. And so they came back convinced that that we should do something, and we agreed. And so we understudied Curitiba and put in our bid, and we hosted the conference. So as I said, for us, the biggest challenge when I look back 30, 40 years back, it's the well-being of our common home. And I enhanced the title, Promoting Planetary Health and Sustainable Development for All. Link, of course, but not in the exact words, to the MDGs revamped as now SDGs, as you know. But we know those two themes, the well-being of the planet and the well-being of and the sustainability of development are the key issues for the world today. And of course, not only we look at it from a Western knowledge, but we also look at it from our equally important indigenous knowledge. And for us, the well-being of Mother Nature is the well-being of us mere mortals. So we need to understand it. And it's reflected in the Rotorua statements. It is reflected in our global working group for Planetary Health, our terms of reference. As Vivian knows, we are members there, and William is a member as well. Our understanding of planetary health is the fusion of the Lancet Commission definition and our Rotorua statements definition, because you have the comprehensive holistic definition of science, ethics, indigenous knowledge, and spirituality. And so that's the platform. Now the vehicle. We established the Global Working Group to make sure that the legacy statements that we worked through in Rotorua is not a one-off flash in the pan exercise. This is a serious, committed strategic exercise. And so the Global Working Group is carrying that forward very strongly, as Vivian and Williami knows. The 5-year strategy of IUHPE is incorporated into that, the outcomes of the work plan and the strategy of our Global Working Group. So when the invitation from WHO to contribute to this the 10th conference, and naturally, because the theme there is well-being, sustainable development, equity, indigenous knowledge, they tend to IUHPE, and of course, President Margaret Berry naturally tend to the Global Working Group, because that's the a topical theme of the day and for our global village. And so, and that's where things are. By the way, the definition of well-being is going to be challenged. As you know, the WHO team is looking at well-being with a new understanding, citing New Zealand and Finland, among other few countries who are moving broader to holistic well-being rather than GDP. And Michael Mahmoud mentioned GDP at the Rotorua conference. GDP and well-being, the framework that New Zealand is using. And so influencing the Planetary Health Alliance Sao Paulo Declaration, we input into that, our team, Global Working Group input into that, and we are signatories, but also we contribute to the shaping of the Sao Paulo Declaration last April, and it came out last October, as we know. So the work in Rotorua is to address the most significant health issue in the world today, as according to the former Director General of WHO, Margaret Chan, and it's ongoing. And within that, it's not just Western knowledge, it's also all forms of knowledge. As Vivian referred to, the strength of health promotion in the Asian region is a reflection not only of the investment of financial resources, but it's intellectual knowledge that is there. And so we see the knowledge of the East, the knowledge of the West, and indigenous knowledge with spirituality and science, of course, coming together. That's our reality in our global village. And the next stage for us in the future is about planetary health promotion. And within the accreditation framework, one of our outcomes that our Global Working Group will be working on with the Global Accreditation Organization, an arm of the IUHPE board and the whole structure, is to begin to explore how our reality today can be woven in as part of the new knowledge that we do, and not just to understand it from a Western secular scientific brain body perspective, but also a hard spiritual, ethical, moral perspective as well. We now see faith-based communities being acknowledged not only at the UN level, but also the Sao Paulo Declaration mentioned that. So all bodies of knowledge need to come together. As I said in Rotorua, we are a one world, one people within our beautiful diversity and one health. And it's about working together at this stage. And we do it in a way that we can go back to our charter to 1986 that there is peace as one of the first determinants, and along the line of healthy environment, the ecosystem to be there, but also most importantly, there should be social justice and equity. So there is great efficacy. We just need to work on it, and the work that we are still leading is building. As they say, we stand on the shoulders of giants who have walked this pathway before. And as navigators, we know that those who came before us have trailblazed the way. And we are galvanized by our challenges, but we are very hopeful because of the future that we will create. We don't just walk into the future, we create the future. And I'm echoing ancient wisdom here and what Semason Duri said in 2004 in Melbourne when he launched internationally the Paimautonga model. So there's enough knowledge there to look at our new reality and shape it up for the next 70 years. The last point, Vivian, is that
you're running out of time.
Okay, we are 70 years of age, and we were born just about the same time that our damage as Homo sapiens, was so marked on this one home planet Earth, and hence the Anthropocene. Some of us are the Anthropos, right? I was born in 1984. 1954. And we need to rethink health promotion to be more appropriate and to be able to take the challenge that we face because of our contribution in damaging the world. As I said in one poem, Homo sapiens waging war on nature, Homo Deus dead. Thank you, William.
Thank you, Sione. I was gonna mute you if you continue, but thank you very much for that word of wisdom. And you have helped me to summarize what I would, you just said everything that I was gonna say to summarize, to conclude this. But let me thank you very much. And all the speakers, I think you know it, you can feel it. And my, I keep on thinking of all the things that we have said in Sankara, and I think health promotion provides the soul for the work that we are doing. We have structure, we have, we have the intelligence and all that. And health promotion actually provides a soul for everything that we do. And in all your presentation, that's what I can relate to. That's what I can feel. We can provide all the information, and we can provide all the science and everything and all that, but you remain humane, and humanity, integrity, and equity, and justice, and all that. It's really what distinguishes, I think, health promotion with any other brand of science and all that. And let me thank you very much as the Vice President of the current Vice President of the IUHPE Southwestern Pacific. Thank you so much. We were not sure what this corridor is going to be, how our conversation, but I think it is really, really good sharing. And we, of course, we are recording it, and we will share it with our colleague. So I would like to thank you, Professor Vivian, Professor Evelyn, Dr. Rosemary, Dr. Mihi, and to Sione. And Leanne and Eva, thank you very much. And I can see Emma and Anna participating. Thank you so much for enabling us to have such a wonderful feast of celebrating the last 70 years and looking forward to the next 70 years. Malo Apito.
Thank you, Vilamani.